Then later on, she became Deputy Speaker of Parliament for a number of years until we elected her as Speaker for the last 10 years. On the party side, she's the first Deputy Chairperson after myself and Hai Chigongo for the National. And she's a member of SEC. So she's somebody who has been contributing for a long time. This time I also want to thank her for modesty and humility. Because when I discussed with her, you know, Africans don't know how to, they mess things so much because they, and I'm glad our mother, she's a Moroccan, like my mother. So I'm very glad that this is the spirit really I want our people to have, to know that it's not the positions, it is the mission. And as long as the mission is being done, pushed, we are very happy. Lee Kuan Yew died a very happy man, and whoever he is now is a happy man, because whatever he was doing was continued by the young people. So I want to congratulate and thank Rebecca Kadaga on this, apart from all the other contributions, but on this particular one, I want to congratulate her. So I thank you, and I wish you good luck. And njagala kwebaza mama waife kurokurabirira mwanyi nazi emyaka gino gyona Kibumba ayebaziwe. Thank you so much.
And the Deputy Speaker of Parliament, Anita Among, has appealed to ex-official MPs to regularly attend House sessions to avoid delay in action over concerns by constituencies. Among the sworn-in via Zoom was Minister for Education and Sports, Janet Kataha Museveni. The Deputy Speaker, Among, made the call while presiding over the swearing-in of non-elected members of Parliament who were recently appointed ministers in the new cabinet. Henry Okrut has more.
The arrival of the Deputy Speaker of Parliament, Anita Among, was expected. She was here to oversee the fulfillment of this constitutional requirement.
I, Janet Kataha Museveni, swear in the name of the Almighty God that I will be faithful and bear true allegiance to the Republic of Uganda.
The oath taken by these recently appointed ministers at Parliament was officially to make them members of the House.
And that I will preserve, protect, and defend the Constitution. So help me God.
I want to take this opportunity to congratulate you upon your appointment to the various ministries and welcome you to the 11th Parliament. I'm looking forward to working with you.
They were challenged to regularly attend sessions, an appeal emphasized by Government Chief Whip Thomas Taebwa.
There is a tendency of members of Parliament, of ministers, not attending the House. Ministers, kindly attend the House, represent your people, and you, your ex-officials. It's about catching the eye of the appointing authority. So you must perform to your best for you to be able to maybe catch the eye of the appointing authority next time and your people in the village.
The ex-officials are the easiest people because they bring in special contribution to the cabinet. Of course, we will take them through procedures of Parliament. Some are former MPs, they already know, but most of them are already exposed.
Comprising both cabinet and state ministers, these members of the Ugandan cabinet pledged to right all wrongs in service delivery. Grace Kuyuchwiny, the state minister for northern Uganda, was one of them.
So help me God.
We had already planned and we had already budgeted. We had already interacted with many stakeholders in northern Uganda. And key this time will be commercial agriculture, intervention of the stakeholders for investment in factories, and employment creation in northern Uganda.
I'm going to work for unity in Kampala. We are going to work as a team with all other stakeholders. And I promise, since I was born in Kampala, I've been in Kampala for so many years. I've studied in Kampala. All my politics has been in Kampala. I promise that we shall work and we are going to prosper Kampala.
The new members of cabinet were named in early June, among who included these ex-officials who are not directly elected members of parliament. They have since been vetted, sworn in, and some have officially assumed the office. Henry Okorut, UBC.
Meanwhile, the outgoing State Minister for Primary Education, Rosemary Seninde, has pledged support to the ministry and the incoming State Minister, Muriku Kaduchu, while handing over office to the incoming minister. Seninde, however, revealed challenges of low funds to implement activities. Now, the incoming minister, Kaduchu, pledged commitment and hard work towards achieving the goals and missions of the Ministry of Education and Sports.
This is a handover report for the incoming Minister of State for Primary Education, which I have prepared for you. It is a detailed report and I hope it will be very helpful.
Position she held for 5 years, the outgoing State Minister for Primary Education, Rosemary Seninde, has today handed over office to the incoming State Minister, Muriku Kaduchu.
I want to thank everyone who has made me be able to contribute, to make the contributions that I've been able to contribute in the Ministry of Education and Sports.
Seninde pledged to continue working and supporting the ministry to make sure the goals are achieved. She, however, spoke out challenges of low funding to implement activities and delayed approval of policies.
Of course, for instance, the ECC policy, it is a very important policy which is just awaiting cabinet approval. Another challenge is that some vacancies within the basic education department are not yet filled. I hope that will be done.
The incoming minister, Muriku Kaduchu, appreciated the outgoing minister for setting a solid foundation for the nation and the ministry in the fundamental backbone of the country.
Primary education is the backbone. You cannot climb the tree from top, but you start climbing the tree right from down. And that is where you've been. I really want to salute you, sister, and I want to say thank you.
She pledged commitment and hard work to have the ministry's goals and missions attained.
And I want to commit my total commitment, my dedication, my time, and to invite God to give me the wisdom so that whatever you've started, whatever initiative you have started, I pick from there.
Jane Yuramcha, UBC News.
Outgoing State Minister for Economic Monitoring, Molika Mukama, has underscored the need for proper use of government resources for effective service delivery. Mukama, who was handing over office to the incoming Minister, Peter Ogwang, called on technocrats across the country to properly implement the parish development model. On his part, Ogwang, who was moved from ICT Ministry, pledged to take on the mantle. The handover ceremony was held at the office of the President in the presence of the Secretary Haji Yunus Kakande.
just push and get your money. Is it 13 billion or what? 11 billion. They agreed to that. So Push Finance, if they promised me that money, they should give it to you. You're also going to help the government of Uganda, including your senior ministers, to call upon them to do what they are supposed to do at the right time. So you have a lot of power and you have a lot of privilege. I wish you all the best in your new term, and I wish the entire team of presidency all the best. And I want to implore you, Peter, you know that we've been working as a team, especially on mentoring young people and developing them. The country called Uganda happens to have a larger portion of our population as young people. As a ministry in charge of oversight, kindly look out for young people because they are the future of this country.
It is us who can begin to look at, there's a problem here. Can we begin to pinpoint and direct that? Since the powers is with us, with this apex then comes in to say, PS, Minister of Water, this will fail to make a performance on the following activities as far as this quota is concerned. In our opinion, you should be taken off. This is now when we can be able. Why am I saying this? The country we have today, the citizenry we have today, is one which is first of all informed by the media, which is here. Number two, they're interested in service delivery. So we must accept to move with them at a rate which, in my opinion, should be able to help us achieve our intended objective.
With that, we take a quick break. When we return, more details. This is News Tonight.
We've cut and reduced our MTN Momo withdrawal rates. Now you can withdraw mobile money at the lowest rates. You also get MTN Senchu points when you deposit, send, and withdraw MTN mobile money. Visit our Momo agents countrywide and withdraw mobile money at our reduced rates from 1st May 2021. Everywhere you go, MTN.
Fellow Ugandans, you know that the current COVID-19 period is a trying time in our lives. However, we still have another threat that has been with us for a long time, and it is called neglected tropical diseases, also known as NTDs. NTDs include bilharzia and worms that cause swollen stomachs. Trachoma causes blindness, and elephantiasis causes the swelling of legs. These diseases are affecting millions globally, and yet they can be prevented by regular hand washing with soap and clean running water, regular washing of the face with a soap and clean running water, keeping dirty hands away from your eyes, always using pit latrines, and discouraging open defecation in your community to avoid flies that carry germs, reporting to the health facility early when feeling unwell. Remember to stay safe and protect yourself. This message is from the Ministry of Health with support from Ascend Project.
Public announcement. The Minister of Public Service informs the general public that tomorrow, Friday, 25th of June, 2021, has been declared a public holiday throughout Uganda to be observed and celebrated as a National Day of Prayer.
Wait, Abu, tunamaliriza. And what are you doing throwing papers all over the place?
I'm looking for an invoice for a sound system and cables that I received yesterday, but I can't find it.
You know there is a way of keeping all this in one place and available to you as and when you need it.
I really wish there was one, because the way these invoices grow legs and disappear.
I believe this is what you're looking for.
Now how did it get there?
Tabo! Do you know that with EFRIS, you can stay on track of all your business transactions and improve on your record keeping?
How so?
Katituli ku computer with EFRIS. I just search using the fiscal document number and I retrieve the records I'm looking for. Bookkeeping becomes simple after that.
Kapo, awesome, yeah.
I began using URS Kakasa Solutions and now I'm in charge of my business. And you can as well.
Kakasa, be sure you are in charge of your business.
Uganda Revenue Authority. Developing Uganda together.
Airtel Uganda has the best and most affordable rates when it comes to withdrawing and sending money. free. Withdraw money for as low as 330 shillings up to a maximum of 12,500 shillings. Sending money is just as affordable as ever. Absolutely unbeatable. Use Airtel Money on the most affordable network with the largest network of Airtel Money branches in Uganda. Dial *185# to get started. Airtel Money. Simple, secure, borderless.
It's no secret that ICT makes learning easy.
The strides made in our field couldn't be possible without it.
And now we can watch our favorite shows.
My radio is my best friend.
UCC provides an enabling regulatory environment and policy guidance for healthy competition. We also facilitate ease of doing business in the communications sector through licensing, standardization, spectrum management, tariff regulation, rural communication development, and consumer empowerment. An informed consumer is an empowered consumer. UCC supports local content and innovations. Driving the development of a robust communication sector in Uganda is Uganda Communications Commission.
Therefore, understanding this model.
Excuse me, lady. Who do you think you are? A queen?
Haven't you heard? Get Airtel Chillax bundles and browse like a queen.
Get Airtel Chillax bundles that do not expire and browse like a queen or king. Dial *175# or use My Airtel app.
Airtel, the smartphone network.
Today in history.
On 24th of June 2002, a large passenger train with over 1,200 people on board rolled backwards a hill into a slow-moving goods train, killing 281 people. The train had traveled from Dar es Salaam to the state of Dodoma in central Tanzania and had passed Msagali and was nearing the city of Dodoma when it began climbing the tracks of a hill called Igando. The Igando train disaster was an accident which occurred during the early morning of June 24th in Tanzania and is one of the worst rail accidents in African history.
Welcome back. You are still watching News Tonight. Now, the Ministry of Health has received personal protective equipment, PPEs, worth millions from Government of Israel to boost the capacity of health in the fight against the pandemic. The personal protective equipment will be distributed to different health centers across the country since health workers are most at risk. The Honorary Council of Israel to Uganda, Ishta Mganga, applauded Israel's support and appealed to Ugandans to strictly follow the standard operating procedures to minimize the spread of the deadly virus.
The 2,000 pieces, coveralls, 451 complete pieces, surgical gloves, examination gloves, and temperature guns. This adds on what we already have. One of our strategy is to protect the health workers who definitely are in the front line. So we're going to distribute this in addition to what we have already to our health workers who are working in treatment centers and in facilities in the country. The distribution is going on. So this is a good gesture that Israel has shown. Health workers, just like all Ugandans, are at risk, but of course health workers are more at risk. We get health workers that have gotten infected from place of work, but also some of them get infected from home in the communities because COVID is everywhere. And I think so far we've lost, in the last 1 month, we lost about 10, but not all of them got infected from place of work. But we have lost some health workers. And many have gotten infected and recovered, just like the general population.
Support the ministry in the fight against corona. So it is, as The gentleman elaborated the various items, N95 masks and overall gowns, temperature guns and masks. Because they are friends of Uganda, so they've donated. They know we are going through a pandemic, a second wave. And I think as a person who you've had good relations with, if you hear that someone is in need, you extend a hand. Accept that this is a pandemic, it's a crisis. No one has a proper answer of how it happens or where it comes from. But we are told, observe SOPs, understand the lockdown. It's not a personal issue, it's an issue. It's a measure that has helped save many lives in many countries, and we just have to comply. Really request everyone, in whatever way you can, observe the SOPs. Don't leave if you don't have to.
And government is still locked in a hard discussion on who is vulnerable, a vulnerable person, how much should be given as relief funds, and the accuracy of paying money rather to the right beneficiary through mobile money transfer. Local leaders in the districts of Kampala, Wakiso and Mukono believe the gesture is positive, but the chosen criteria may run down the set purpose. Let's take a look.
In 2020, Government of Uganda, through the Office of the Prime Minister, extended relief aid in terms of foodstuffs to the vulnerable in the first lockdown. Although the process was timely, but it was entirely regarded to be a sham exercise, as many of the beneficiaries continued complaining about the quality of the foodstuffs.
Quality of food last time was a big N-O. You saw how the suppliers were fighting themselves. It was, unfortunately, people were taking advantage of the vulnerable people.
Following the irregularities that marred the exercise, this time round government is pondering for another alternative to deliver COVID-19 relief to the vulnerable via mobile money transfer platforms. However, the question that hangs on the lips of many local leaders is the reliability, accuracy, and whether government knows the people regarded vulnerable it is going to rescue.
Who is going to scrutinize that in the family we have not gotten more than 4 lines? Because it is possible that in one house you can have 4 mobile phone numbers, and therefore one family may benefit, and there is also another family which has no mobile phone.
Because the questions we have is, how have they generated the list of the vulnerable people? Who are involved in that, in helping the Prime Minister's office?
However, financial transaction risk analysts have expressed fears that government is likely to cause a financial loss to the taxpayers through paying ghost persons, which is a breach of the Know Your Customer's customer.
You cannot tell me you are a vulnerable person when your phone has been receiving millions of shillings. So even when they bring them on the list, we shall check your phone. It has been getting 500. It has been getting money. And then you say you are vulnerable.
However, Dr. Chris Baryomusi, the Minister in charge of Information, Communication, Technology and National Guidance, confirms that indeed government is learning from the past experience.
You recall we were giving posho, beans, milk, some categories of people, and sugar. But on a whole, we found it a little bit complex and problematic. That if we took that direction in 42 days, we may not easily succeed to reach out these vulnerable people when we go to give physical food.
Among the targeted districts are Mukono, Wakiso, Kampala and other areas. However, local leaders remain skeptical about the mode of relief transfer to the could-be vulnerable.
A normal household person needs minimum of 5,000 per day. So if you count 5,000 per day times 4. 4 times 5 is 200,000 a month per person. So is that also possible?
If you are distributing that money, there is no, you have no guarantee that that money will sustain people for more than a week. So what are you trying to give us to say? That people are going to eat for a month today and we store the food in our stomach? It's not practical.
Among the many unanswered questions remains who will generate the database of the could-be beneficiaries, how much will they be given, and how long will it sustain them?
How are you going to ensure that the right people get the right money? Who is going to manage the data? Who will be there to scrutinize that actually what has been brought from Namulanda Sea are the real needed people?
Money is actually poison. I see the issue of money is more dangerous because now it's going to be like a harvest season.
Whether government will extend the COVID-19 relief assistance to a section of members of the public who are considered to be economically disabled by the 42-day COVID-19 lockdown or not, the reality remains that COVID-19 is here to knock on everybody's door, regardless of who you are and what you possess. Robert Onyango, Kampala.
The Executive Director, Kampala Capital City Authority KCCA, Dorothy Kitaka, has revealed plans by the City Authority to intensify measures to enforce the standard operating procedures to all market vendors in Kampala. Kitaka, who was receiving a consignment of 2,000 mosquito nets donated by Equity Bank worth 14 million shillings, applauded the bank's gesture to help market vendors.
Following the President's directive on the second lockdown to counter the widespread of COVID-19, markets were among the sectors allowed to operate while observing the standard operating procedures. The directive granted market vendors dealing in foodstuffs to reside in their area of operation. But the major challenge has been accessing basics, including mosquito nets and sanitizers, among others. As part of its social corporate responsibility, Equity Bank has donated 2,000 mosquito nets worth 14 million shillings to Kampala Capital City Authority to help prevent malaria. Equity Bank Executive Director Banking Operations Anthony Chituka says the bank has designed flexibilities to support consumers at all levels.
We believe in working together. We believe that we can support the women, the youth, and everybody who's working in the markets and in other areas of Kampala. We have solutions and products for various categories of people who are probably going through a hard time during this lockdown and during this pandemic.
While receiving the consignment at KCCA headquarters, the Executive Director Dorothy Kitaka applauded the bank for its unwavering support to vendors of St. Walikudembe Market, among others.
We as KCCA want to support the city dwellers, and when we get partners like Equity Bank who are willing to support us in financial literacy, in health and all the other products, we welcome you very much.
At the moment, as part of the enforcement of SOPs, the city authority is engaging with border motorists and market vendors to deliver products to customers.
As KCCA, we've come out with a matrix that lists all the markets and the various telephone numbers of the vendors in the markets who are selling things. So, together with the border workers, we would like our city dwellers to ring these numbers so that the goods can be brought to your house.
However, Chitaka was quick at appealing to KCCA law enforcers to refrain from harassing city dwellers.
This is a time where people don't need more anxiety by beating them and throwing their goods. We have to be humane in our approach of law enforcement, but on the other hand, we require city dwellers to abide by the trade orders that are put in place.
Kampala Capital City Authority has expanded Usafi Market, which can accommodate street vendors as it plans to provide facilities to all markets in preventing COVID-19 spread. Jane Ngiramjia, Robert Waita, UBC News.
Public announcement. The Minister of Public Service informs the general public that tomorrow, Friday, 25th of June, 2021, has been declared a public holiday throughout Uganda to be observed and celebrated as a National Day of Prayer.
We've cut and reduced our MTN Momo withdrawal rates. Now you can withdraw mobile money at the lowest rates. You also get MTN Central Points when you deposit, send, and withdraw MTN mobile money. Visit our Momo agents countrywide and withdraw mobile money at our reduced rates from 1st May 2021. Everywhere you go, MTN.
Fellow Ugandans, you know that the current COVID-19 period is a trying time in our lives. However, we still have another threat that has been with us for a long time, and it is called neglected tropical diseases, also known as NTDs. NTDs include bilharzia and worms that cause swollen stomachs. Trachoma causes blindness, and elephantiasis causes the swelling of legs. These diseases are affecting millions globally, and yet they can be prevented by regular hand washing with soap and clean running water, regular washing of the face with a soap and clean running water, keeping dirty hands away from your eyes, always using pit latrines and discouraging open defecation in your community to avoid flies that carry germs, reporting to the health facility early when feeling unwell. Remember to stay safe and protect yourself. This message is from the Ministry of Health with support from a SAIN project.
Wait, Abu. Tunamaliliza. And what are you doing throwing papers all over the place?
I'm looking for an invoice for a sound system and cables that I received yesterday, but I can't find it.
You know there is a way of keeping all this in one place and available to you as and when you need it.
I really wish there was one, because the way these invoices grow legs and disappear.
I believe this is what you're looking for.
Now how did it get there?
Tabo! Do you know that with EFRIS, you can stay on track of all your business transactions and improve on your record keeping?
How so?
Katituliku computer with EFRIS. I just search using the fiscal document number and I retrieve the records I'm looking for. Bookkeeping becomes simple after that.
Kapo, awesome, yeah.
I began using URS Kakasa Solutions and now I'm in charge of my business. And you can as well.
Kakasa, be sure you are in charge of your business.
Uganda Revenue Authority. Developing Uganda together.
Public announcement. The Minister of Public Service informs the general public that tomorrow, Friday, 25th of June, 2021, has been declared a public holiday throughout Uganda to be observed and celebrated as a National Day of Prayer.
Airtel Uganda has the best and most affordable rates when it comes to withdrawing and sending money. Withdraw money for as low as 330 shillings up to a maximum of 12,500 shillings. Sending money is just as affordable as ever. Absolutely unbeatable. Use Airtel Money on the most affordable network with the largest network of Airtel Money branches in Uganda. Dial *185# to get started. Airtel Money. Simple, secure, borderless.
It's no secret that ICT makes learning easy.
The strides made in our field could not be possible without it.
And now we can watch our favorite shows.
My radio is my best friend.
UCC provides an enabling regulatory environment and policy guidance for healthy competition. We also facilitate ease of doing business in the communications sector through licensing, standardization, spectrum management, tariff regulation, rural communication development, and consumer empowerment.
Welcome back. You are still watching News Tonight. Now, Uganda has recorded over 74,000 cases of COVID-19 infections and over 700 deaths since March last year. But in the last month, 1 month alone, the number of infections have increased 17-fold even, as well as the number of deaths. They have as well increased. With me in studio is the Permanent Secretary, Ministry of Health, Dr. Diana Twine, to just give us an update on some of the interventions that the ministry is doing in the fight against COVID-19. Welcome to our viewers.
Good evening, viewers, and thank you for having me here.
Concerning what we are doing, I'm not sure the time we have will be enough, but we are doing so many things. This pandemic has been there for over 1 year, and we are in the second wave, and you all know the second wave is worse than the first wave. We have lost so many people, and we have also gotten more numbers of very, very sick. And we have seen most of our hospitals fill up, both public and private. We have seen the use of oxygen more than triple because of the numbers that are critically ill. But I want to say that all is not lost. When you look at the number of people that are getting infected and the people that are being treated and go home, those are the majority. Today, I just want to bring hope to Ugandans that the majority of the people are healing and they are going home. Yes, we have a number of those that have succumbed to COVID. May their soul rest in peace. But I want to tell you that our health workers are working day and night to make sure that our patients are taken care of. And I want us also to appreciate that COVID is extremely expensive. To take care of patients of COVID, even the simple conditions that you not imagine that would take a lot of money, but for the patients of COVID, there's so much that is required to take care of just one patient. When you talk about PPEs alone that we spend, PPEs, I'm talking about the headgear, talking about masks, N95, talk about coveralls, talk about shoes, we talk about that sanitization alone and in the hospital. It is quite a lot of work. But we have been able to do that all this time from last year. Today I thought would mainly talk about what is disturbing the public, the charges. There has been quite a lot of outcry, and rightly so. The public has the right to raise this issue because it is incredibly expensive for the person, the common person. And today, I just wanted to come to tell you that the Ministry of Health is not sleeping. I have heard people say that we are doing nothing, that we don't want to talk about charges because we are beneficiaries. That is very unfortunate. It is not in any interest of us to see our patients being bounced. By the way, we would want to take care of everyone under public facilities because we know their government pays. I want to tell you that those people, thousands of people we are treating in public facilities, the services are not free to everyone. Someone is paying. It's just because that we don't hand over the bill to the patients that we are not paying. We are paying for all those patients that have gone through our hands, that have gone through our hospitals. Government is paying for her citizens. The only challenge is that we did not have enough space. We keep on increasing space, but the rate at which the numbers that accumulate is very big compared to the rate at which we are building capacity and expanding. Every patient who comes to our public facility and is treated and goes out, government pays for that. So the first principle is that even in public facilities where people go and get treated, government invests money to ensure that everyone who comes there is treated. All those tests we do, all those consumables we use, government pays. They are not for free. No one comes and just hands over from somewhere and just puts the things there. Government invests money. Now, coming back to the private sector. Now, in Ministry of Health, first of all, we do not agree to overcharge, and we have never condoned overcharging. What government has been doing over time before COVID, we have a policy that we use to work with private not-for-profit. Private not-for-profit hospitals, these are church-founded hospitals and or Muslim, whatever, under Islamic foundations. Government every year gives billions of money to these hospitals to subsidize their services. When you go to Mengo, when you go to Nsambia or Rubaga, and their charges are slightly lower than, for example, the facilities that are profit-oriented, you find that the charges are far bigger. I mean, the difference is big. Why? They give the same services as those in private for-profit. But what is the difference is that government each year gives money to these facilities and negotiates with them to subsidize the costs so that the common man, because all people cannot come to public facilities, they go to these mission hospitals and they receive services that are subsidized. What does that mean? Government pays part of that money that they would have charged. We pay money there, we give medicines, we second staff, we second even doctors in these facilities, and we give even other equipment and other, like how would handle our facilities. Why? Because we want to subsidize the services so that not everyone who can come to the public facilities can have an alternative, but affordable. When COVID came, at first, we thought government would take the burden, because we anticipated that, because we definitely knew that the common man would not be able to manage to go to the private facilities. And at first we were actually criticized that we were not letting the private take over also the care. But we knew that there were those challenges, because this time around, unlike budgeted resources, these resources were not there to give to all the private facilities so that they subsidize. We did not, and we did not give them any money. So we don't have any special arrangement under COVID that, please, we are giving you money, we are giving you equipment of ICU, we are giving you consumables, we are giving you PPEs, therefore cut down the cost. So when this phase came and we saw that really we needed to open up for more facilities were accredited, they applied, they were accredited, they were assessed, and they were ready to take care of the patients. They went ahead and invested. Most of those facilities didn't have ICUs. Some took loan because we have been engaging them. We have been engaging them and we are saying, why are you expensive? Why are you expensive? For God's sake, why don't you really charge reasonable? And some have come out actually and told us this is how much we have invested. And we are in loans and we cannot, you know, cut these costs so low. We will not be able to pay, to repay. And this engagement is still continuing. We have not stopped. We are engaging them, and even good enough now, the Office of the Prime Minister is going to coordinate these efforts. And Right Honorable Prime Minister is going to call us all together so that all the sides are able to be heard.
Doctor, will there be a breakthrough? Just today there was a meeting between the private hospital managers and State House officials. And indeed they raised that treating COVID-19 patients is not, it doesn't come cheap. There is no binding law for them to not charge the money that they are charging.
No,
is there hope that we will have a breakthrough with the discussions that the officials are having with them?
We hope that there will be a breakthrough, because there are certain areas we think that we must agree. For example, if the private entity is able to get free oxygen from, we have got support from a number of factories that have been able to set aside what they are doing, and they concentrated on making oxygen for us in Uganda, because our oxygen plants in the country, in the hospitals, were not able to meet all the needs. And this oxygen is being given freely. They don't sell this oxygen, except one particular factory where they sell, that is their business, they sell oxygen. But other factories like roofing, like steel and tube and other, we have like 5, they've been trying to help us to bridge the gap. They have been giving free oxygen to us. And we asked them that please also bring on board the private, because they are bearing the burden on our behalf. And they have been actually giving oxygen to these private entities. Not completely, yes, except that when they choose to go to buy, maybe the other side when the demand is big and they choose to go and buy, but still even the cost of oxygen is not that much compared to what they are charging. Sure. And these are key areas that we are concerned, and we are saying, okay, if you are justifying to pay your workers because of the risk, the PPEs you don every day and you throw away, and that is consumable, that's very expensive. Okay, let's look at the costs and we see where we can come in the middle. And today we're actually analyzing the cost, for example, and we are saying, for example, just accommodation overhead. Minimum, you need $216 per day per person. Staffing, pharmaceutical, the medicines and all that, it came to 20 in total. When we, okay, genuinely, if for example were to treat the patients in our unit, and we are looking at we think if someone stays really long, think at least minimum 27 million. But we have heard where people are paying much more.
100 million.
So this engagement is going to continue. What I wanted to tell you also is that in the Ministry of Health, for us who deal with policy, we do not make the law, but we know the law that governs our practice. and for example, the medical councils, our medical councils that are charged with the practice to make sure that we follow the ethics, we do everything according to our standards. They are guided by that law, but they do not have in that law where government will come and say, hey, I am ordering you now
to stop.
You must cut your money, you are charging this and charge this. We don't have that law. Sure. If someone chose to ignore you and continue charging, you will not be able to come and close the hospital, you will not be able to do anything. You can only engage in the discussion, in dialogue. That's what we are doing, and we believe that this dialogue is going to yield some results. We are continuing. Now, we have our policy documents. I came with this small book, Patients' Rights and Responsibility Charter. This book guides us in the Ministry of Health, in the practice, even the private practitioners. In section 20 here, we are supposed, here we have the rights to transparency in charged fee rates. This is what we provided for. So that when I choose to go to a private hospital, and I'm going to make a decision whether I should be admitted or not, I am supposed, and it is my right, to be taken through the cost in a manner that is transparent. That, you know, when we admit you, these are the costs you are expected to pay. Admission fee is this. The surgery, if you are going to do surgery, is this. This, you know, in order to take through that person, and then the person gives informed consent, so that when they accept to be admitted, they are fully aware of the repercussions, so that even each day that passes, they are fully aware of the cost implication. If they want to change, they can even ask for the hospital to relocate. It does not allow in this booklet of ours, it is prohibited to hold the body that someone must pay. Therefore, we are not allowing you to go until you pay. It is not acceptable. So we have the Patient Rights and Responsibility Charter that guides how both government and private facility should deal with patients. And for me, this is the most important thing on our side for enforcement. So if for example, a patient was not provided any information and came in a crisis and maybe, for example, they realize that the cost is unimaginable, it is not late. The patients must be taken through to get to know what they are signing up for, whether they'll be able to manage. If they cannot, they move to another place. The challenge that has been with COVID is that this is highly infectious disease. No one will just take up anyhow anyone who has been taken as COVID. So when you say that, even if the patient discover that the place is expensive, I think that the best way is to create an avenue where the patient from the beginning, they get to know this. The other thing is also the client charter. This one, we have got also this client charter. It gives also the details of our responsibility and the patient responsibility. And I think I will have to come back here and discuss, because I know that we don't have time. But these are documents that we rely on to even to policy or to implement the policy in our health sector. We do not have any law. So when you hear people say, you Minister of Health, you're negligent, you don't care, because you are beneficiaries. I don't know how even the Ministry of Health can benefit from some hospital that is charging. So what we want to do moving forward, we are trying to gather the charge, because you see, to make decisions you need to have statistics. The private practitioners they are also they have an umbrella of the Federation of the Private Practitioners. We are engaging the federation. But most importantly, we want them to realize that this is a war together. We are in the war together. There are certain things that we must put aside for the sake of saving lives. Of course, when we meet them, their challenges is that government, please give us PPEs, give us ICU equipment. Then if you do that, then we shall cut down the cost. Second, workers to us, so that you pay salary, and then we cut down. But then we are saying we are carrying the biggest number of patients. Therefore, we need to be cognizant of the fact that even us, our budget is not sufficient enough to take care of our facilities. Again, we come to the private and give them more money. We do that through the budget, but also only private, not for profit, not all facilities that government gives the money. So I felt really that, and we are going to analyze all the charges of all the hospitals. We are going to look at the standard, and we are going to benchmark. We're not necessarily going there, but we are going to look at, for example, in Kenya, for example, in US, what does it take to treat someone in ICU for 3 weeks? How much money do they spend? And then we look at, is it reasonable? But that requires time. So we are not sleeping. We are doing something, and really we want the people to access care. Ultimately, we want everyone, because every life matters. Every life. For us, if we had a way, we would simply say no more care in the private. Please get everyone to our facilities and we treat you, but we can't. That is such a big burden. That's why we brought on board the private to support us. But we also want them to know that we are together into this. We don't want to appear as if we are forcing them to change things, but at the same time, we want them to apply reason, humanity, so that when we sit together on the round table, we all come with open-minded to help. We want to help, we want to support, we want to make sure that the people who are affected really do not lose lives because they don't have money.
Thank you very much, Doctor. Because of time, we can't continue, but we will get a chance to delve more into the issues of interventions in the fight against COVID-19. And that does it for News Tonight. I am Rhoda Ngonzi. We do return at 10 o'clock with more details.
Brought to you by
Your Health Chart is brought to you by National Medical Stores.